Welcome back to Psychology of Learning with Dr. Goodin. We're in Chapter 9, looking at the applications of operant conditioning. Operant conditioning is important because it supplies a conduit for our learning history. Of course, when we are children, we whine and complain, especially over the punishments. However, in later life, we see the results of our learning history or upbringing. Learning history is important in our homes and is normally based on the type of parenting we have. Were your parents consistent? Are you a consistent parent? Operant conditioning is learned in schools as well. Children may be given praise, attention, a gold star, a paddle. Overall, when appropriate behavior is reinforced with positive consequences such as praise, recognition, and approval, and minor misbehavior is ignored, the usual result is an increase in appropriate behavior and a simultaneous decrease in inappropriate behavior. There are many health disorders that involve behavior problems, so operant procedures can be used in clinical settings. Operant learning is used in the treatment of various problems such as self-injurious behavior, which is normally treated with reinforcement procedures. Delusions or false beliefs that anyone can have, but are most common among schizophrenics. If reinforcement is not given for bizarre behaviors or delusions, they are likely to decrease. Goldilocks paradox is the apparent absence of maintaining consequences or the presence of aversive consequences on some occasions may be requirements that must be met for reinforcement to be available on other occasions. Now that was complicated, right? Let's break that down. Basically, we're describing the situation wherein you get out of going to school for faking sickness, feigning illness. But if you cheer about getting out of school, you'll be sent back to school immediately. That's the Goldilocks paradox. Operant conditioning may also be used with paralysis. In order to rehabilitate a transient paralysis of the limb, for example, they use constraint-induced movement therapy. They will secure or place a splint on the unaffected limb, forcing the patient to learn to use the injured limb. Otherwise, people often would never work to regain movement of the injured limb. Of course, operant conditioning is also used at work via bonuses, pay increases, and benefits. Operant conditioning has even been used in the zoo with aggressive animals, for instance, shaping the behavior of an aggressive bull elephant to place its foot through a hole in the bars so that it has calluses on its feet, so that its calluses can be scraped off its heel safely. Additionally, since the life of captive animals is much different than what it would be in the wild, operant conditioning has been used to make life more enjoyable and humane for them. For instance, zoologists have found that they can improve the lives of zoo animals by allowing them to obtain some of the food through their own efforts. Now, this chapter is very short, just really one slide. Although this chapter is somewhat discussion-oriented and simple, it should be clear that operant conditioning plays a vital role in many aspects of our daily lives, from the training of our children and pets to the reasons we go to work, to make money, to buy food. I will see you in Chapter 10.